Hello guys, welcome to Brain Medics. Tonight I'll be talking on about the problem we're facing in our society, especially among married people, among couples that has led to complicated issues. I want, please, before I go on part of my grammar, I'm not a grammarian, so and what's the problem is infertility. Have you ever heard about infertility? Infertility, on my own definition, I can say infertility is a reproductive disorder, a reproductive disease. That is, a failure to achieve a clinical pregnancy for 12 months of or more after unprotected or regular sexual intercourse. So that was what we mean by infertility. And this infertility is of two types. One, we have primary infertility and secondary infertility. The primary infertility occurs when you give it back to one child for and he still wants more, but suddenly you can conceive again. That's what we mean by primary infertility. But the secondary infertility, like you've not conceived at all, that's what we mean by secondary infertility. But this issue, have you ever asked yourself, what's the causes of this issue? What's causes of this problem in our society? I know some tribes they see it as, especially among some tribes, they see it as spiritual attack, spiritual problem, and all, of which is not good. Have you ever noticed what happened to this problem? No. But I wanted to know something. You can't keep blaming women on this because among some tribes they keep blaming the woman of which they will marry another girl or another lady for the husband without knowing that 40% of this problem comes from men. Men contribute 40% of infertility nowadays. And it's a great problem. We don't know. Oh, so do you know we are new era for someone to get married, they will do pre-wedding pictures, pre-wedding this, pre-wedding that, pre-wedding that. But why can't you go for pre-wedding screening? That's what we call pre-wedding screening in order to save unnecessary tissue because I could see it today. It's one of the problems some newly wedded people are facing. Why can't we go for pre-wedding screening instead of going into marriage? Instead of going for pre-wedding pictures and all. I'm not, don't quote me wrong. I did not against pre-wedding pictures. But on the safer side, you go for pre-wedding screening in order to save this. Apart from that, there are different types of pre-wedding screening you do as genotype issue. Apart from that, you go for what we call fertility test in order to save unnecessary argument, to know who has a problem, whether you should proceed or whether you should find solution before you get into the marriage. Go for what you call fertility test. Let the man know, let the man do semen analysis and hormonal assay, whether he's capable of giving birth. Let him do semen analysis, whether it has scanty sperm, it is called oligospermia, maybe it has dead sperms or no absence of sperms, which is called azoospermia, or maybe it's normal, it's normal spermia. And the girl should do what we call hormonal assay. Both man and female, they should do hormonal assay too. Whether the woman can conceive or not, maybe he's having regular menstruation, he's having regular menstrual cycle, or he's facing amenorrhea. So why can't we go for this? Why keep blaming women? Ask yourself. Because what is happening nowadays is they kept blaming women about the infertility issues, about this, of which is not right, it's wrong. Very, very wrong. We can't keep blaming the women. We can't keep blaming them, because a lot of things, a lot of radiations, a lot of things, we men exposed to a lot of things in life that affect their sperm production, especially those drunkard, the smokers, the many bad things like that of it affect. They have effect. All these things has effect on the sperm production. But you don't notice. After getting married, the next thing is you don't conceive for a year, 2 years. The next thing is to go for another wife. Look for another wife. Does that make sense? It's not. There are some issues about this. There are some issues I would like to discuss about this infertility. But this is just an introduction. All that in the part two. Thanks for listening. And don't forget to share. Thank you.